Hi, I'm Dr. Bixler, and today I'm here to talk to you a little bit about some terminology that's commonly used in mental health and some things that typically you and your therapist are going to be looking at. And those terms are frequency, intensity, and duration. Why are those terms important? Because really this boils down to, are you seeing progress in the reasons that you showed up to therapy? So we all come to therapy for reasons, and those reasons are typically distressing to us. And what we typically want to see over time is that those reasons or symptoms are decreasing in frequency, intensity, and duration. So let's talk about what that means. Frequency is very simply how often are you experiencing those symptoms in a week, in a day, in a month, in a year. Intensity is the idea of how overwhelming the symptom is. So how impacted are you by it in the moment? How overwhelming is it for you? What is that sensation? That's the idea of how intense something is for you. And then duration is really how long does that last? So how often is it happening? How overwhelming is it? And how long is it lasting? And we want to see, as you are engaged in therapy or other kinds of treatment, that those symptoms decrease in those categories in frequency, intensity, and duration. Your treatment team, your therapists, your whatever treatment you're in, that is always something that we are hopefully measuring. I think it's useful for you to have an understanding of those things. I think there is a lot of hope in seeing improvement. Sometimes I think where people look for improvement the most often is in that intensity category, where we'll start to see a lot of improvements in frequency and duration that tell us that we're going down the right road. Whereas the overwhelmingness when you do experience your symptoms may not be the first thing that you notice. And so I think it's important for you to understand how to measure some of your progress too, because the installation of hope, the idea that things are changing, that can be the thing that begins to affect how overwhelmed you feel. And so it's nice when you as a client can come in and say, hey, I noticed that this only lasted 15 minutes where it normally lasts a half an hour for me. That's a really good piece of feedback for yourself and your therapist and your treatment team. I think they're just important things to note. I'm going to say one last thing. These things we measure separately from the idea of clinical severity. I'm not going to try to be too complicated here, but I think this is an important idea. When you might have your therapist or read one of your notes or get a report from one of your therapists and they say, oh, your severity is mild to moderate to severe. They are not measuring those three things specifically. They are measuring how you are being impacted or impaired in your day-to-day functioning. Now, the hope is that they correlate, right? Like if we decrease frequency, intensity, and duration, how you're being impacted in your day-to-day life should improve. That's not always the case, or sometimes you only get a little bit of improvement in frequency, intensity, duration, but you get massive improvement in how that's actually playing out and how you're being impaired or impacted in your life. So just wanted to add that as well. Let's talk about that idea of functioning. This really boils down to the idea of, is there places in your life where your symptoms are stopping you from having some of the things you want? Are they impacting your relationships? Are they impacting like your areas of vocational or academic pursuit? So are they impacting your job? Are they impacting how well you're doing in school? All of those things are what we mean by areas of functioning, is really just like how impaired are you in what you are trying to accomplish in life. So how can you use these concepts of frequency, intensity, and duration to help yourself in therapy? I think a really good way to approach that is to put on what we call kind of a curious thought process or a curious mind. So maybe your therapist and you are really working on um, episodes of anxiety that you have. A really good thing to do, maybe the day before you see your therapist, or taking some time to go and have some quiet time before you go into therapy, is to sit down and just be reflective of like, hey, what did that look like for me this week? How many times did it happen? Is that less than it's happened before? How long did it last? Is that shorter than it normally is? Did I feel as intensely impacted as I normally do? Be curious with yourself, and then bring that curiosity into your treatment team and say, hey, I've really been thinking about this. I've been observing it. I think, wow, it feels less intense, but it's happening more often. What's that about? And then we can aim again for you to see that continued improvement, right? And for you to even ask yourself curious questions like, is that better or worse for me? If it's less intense but happening more often, is that better or worse for me? Being internally reflective and curious is a really good tool to help you leverage these things to get you even further in therapy.